The opinions expressed on this program are those of the hosts, guests, and participants, and not necessarily those of News Radio 105.7 FM and 1490 AM WTTB or its advertisers. Welcome to Cindy's Health Beat. Now, ladies and gentlemen, here's Cindi.
And good morning. Welcome. This beautiful, cool weather. What do you think, Jesse?
Oh, yeah, I love it. Fall is in the air. It's beautiful.
Oh, let's hope we have a couple of months of just like what we've had this week. It was absolutely gorgeous. Cindi Bryant here with Cindy's Health Beat on News Radio 105.7 FM and 1490 AM WTTB. And they can also go on the website, www.wttb.
WTTBAM.com.
AM.com.
That's right.
And you can scroll down and find a history, or as Jesse would like to say,
the best of.
Ah!
Yeah, the best of the Cindy's Health Beat.
Okay, so we're not going to call them archives anymore?
No,
okay,
why not?
All right. Whew, I won. Okay, thank you, Jesse. The best of Cindy's Health Beat. And you can listen to some of the prior shows. Mm-hmm. And today I actually have Colleen Symanski, registered nurse, certified diabetic educator, on the other side of the table. Do you know why?
Yeah, I really don't.
She's actually a guest today.
Okay.
She's not my co-host.
All right.
But she usually is the co-host, and she's the editor of Heartbeat of the Treasure Coast.
Yeah.
She's also owner of A Healthier Me.
Yeah.
With co-owner Ken Symanski, who's the personal trainer. And she's She's the girl to go to. She's the guest.
Yeah,
she's my
welcome.
health coach. How are you doing this morning?
I am doing fabulous, Cindy, and I have to agree with you. The weather is gorgeous. And how are you doing? How are you doing, Jesse?
Oh, doing well.
How do you like being on the other side of the table? You knocked your knee when you first sat down because you're not used to sitting there.
I'm not used to sitting here. I hope I can do as well as I do on the other side where You know what? I was going to say saying not much.
No, that is not your forte.
No, I know.
That is not your forte.
It's such a pleasure to be a guest.
I know, because we have a lot of important things to talk
about
today. And we also have Cindi Green, registered nurse, director of marketing and community relations at the Florida Eye Institute.
Good morning, Cindy.
And you're not new to the show?
No, I've been here before.
Yes,
I love being on your show. Thank you.
I know.
Thank you for having me.
You do such a great job. You should have your own show.
No. Yeah. It's great being on your show.
Well,
it's being on your show.
It's nice
and hello, Jesse, and hello, Colleen.
Good morning, Cindy.
And hello, everyone.
Yes,
we
happy
got two
weekend.
Cindys.
We do. One with an I and one with a Y.
That's right. Yeah.
Just to confuse everybody.
Right.
We can have a. Well, that wouldn't be fair because they would go online. I was going to say we could have a contest and have callers write in or text in or email which one of us has the I and which one of us has the Y.
True enough.
But we can't do that because they could it's so easy these days just to Google.
To figure it out.
So everybody would win. And then we would really be in big trouble with prizes.
Yeah, we would be.
Oh, yeah. I just go to Healthier Me and Florida Eye Institute saying, I need another gift certificate.
I like that contest.
Well, what we're here to talk about today is what? The 4th annual Diabetes Head to Toe and Health Symposium and Health Expo.
Yes.
And it's right around the corner. It's going to be.
It is. Oh, my gosh. It is next week.
It's November
Friday,
18th.
November 18th.
Yes.
Right.
From
Very
10
excited.
a.m. to 2 p.m. at the First Presbyterian Church right here in Vero Beach.
Yes, exactly.
It's the go-to venue.
Exactly. And it's a lovely venue. For those of you, if you have been there, or if you haven't been there, it's fantastic. They have a terrific audio-visual system, a lot of room to make yourself comfortable.
Good parking.
And learn some great stuff. Yes.
Yes. And this is your 4th annual, actually, because you really outgrew.
We outgrew our space.
Isn't that that's good news, right?
It's very good news.
Because of the prior 3 years, you've had wonderful, huge attendance, so you really had to move it to a larger venue.
Yes, and it's so nice that Florida Eye Institute's right across the street from First Presbyterian Church, and Colleen and I kind of had a vision in the last couple of years of being able to take it across the street, and as Dr. Graham, one of our speakers, says, take it to the church. Yeah. So we are really glad to have that venue and looking for a great, great crowd, and think it will probably be about 150 people. So
easy.
Yeah, really looking forward to that.
Yes.
It is not too late to RSVP.
Oh, no.
We really want to encourage anybody with pre-diabetes, or if you have diabetes or you have a loved one or a friend with diabetes, this is the symposium to come to. And it's a positive, uplifting event. You're not going to leave going, oh, boy, diabetes.
Right. I've heard that.
Not from our events.
No, I've heard. No.
Not from Colleen.
I really meant the opposite. I have heard what you all have put together, and I think it's going to be very exciting, very inspirational to those that do have diabetes and or friends or people that have friends or family that are dealing with diabetes, and how you can live a wonderful quality of life with diabetes. And this is exactly what you're going to be showing them, and some easy things that you can do for yourself. But we'll talk a little bit more about that. Cindi, why don't you tell us just a little? We know that it's November the 18th. It's from 10 to 2. How do they RSVP?
Well, that's very easy.
Okay.
They can RSVP through Florida Eye Institute. You can give us a call at 772-569-9500, or you can actually register on our website as well. Go to www.fly, that's spelled FLEYE.com, and under upcoming events, there's a tab for November events, and you'll find the Diabetes Head to Toe flyer posted there, and also an area where you can register. And then that email will come right to me, and I'll get you on the list.
Okay,
It's
so
as
that's
easy as that.
Easy as that. But if you didn't catch that right away, don't worry, because we're talking
We'll
to
tell
Cindi
you later.
and Colleen for the whole show, because we've got a lot of exciting things to talk about what's happening there. But let's start first with Florida. Give me a little history of Florida Eye Institute.
Right. It sounds kind of unusual, right, that an eye center would be sponsoring a diabetes symposium. And I was explaining to somebody the other day how it came about was we have a retina specialist, and one of his main jobs is to see individuals who have indications of eye disease. Diabetes can lead to very damaging an eye condition called diabetic retinopathy. And the reason why is because the back of your eye at the retina holds thousands and thousands of tiny blood vessels. And if you're familiar with diabetes and how it impacts your health system, it affects the small blood vessels of the body. And it can be visualized very easily with a retinal exam. And we were talking a few years back and saying he was noticing that he was either seeing people in a moderate stage of diabetic retinopathy, and wondered why he hadn't come across these patients sooner. And so it became kind of a mission for us to educate referring physicians that for diabetic patients that it was crucial that they get a diabetic eye exam annually, because things can change rapidly. And even without a patient having visual symptoms, they can show evidence of disease on the retina. And that's when we want to see them, when we can find things early and treat so that they do not end up with a visual deficit. So that's kind of our goal. Then we came to understand that, you know what, we've educated the physician community the importance of a retinal eye exam. We probably need to educate the community. And we thought, what better way? Colleen and I are good friends. What better way was to kind of hold a symposium or put together a seminar featuring physician specialists, because diabetes is complex. There's no doubt about it, and affects many different body systems. And so why not have a seminar or an event where someone can come and learn information from all those various specialists and kind of put the pieces together, right?
Exactly.
So that it's not as overwhelming or confusing, and include within that piece the importance of eye care. But the great thing about the symposium is we are talking about diabetes literally from head to toe. So we've got the foot doctor, we've got the eye doctor, we've got the internal medicine physician, and then we've got the specialist, the endocrinologist, and of course we have Colleen, our diabetes educator this year, who's going to be speaking and doing a great presentation. So we are covering a lot of bases and helping people understand the importance of diabetes on every part of their life.
And this year we have Tina Giambanco, who's a licensed mental health counselor, and she's going to be talking about the emotional side of diabetes as well as the depression that goes with any chronic disease. So we've been able, if anybody's attended it in prior years, we've added 2 additional speakers to bring some good take-home points with it when they leave.
Right, covering it more from a complete comprehensive viewpoint. And very exciting this year, because we're in this new space, we have the availability of having local resource information, and that is why we're calling it an expo. So along with resource information from other local healthcare providers, we'll be providing free screenings, from vision screenings, some dental screenings, blood pressure readings, blood sugar checks, things of that nature, and people will be able to meet with local providers and really find out all the services that are available within our community. And they'll probably be quite surprised, to know that there is a lot of good information and a lot of help that they can access. So that was one of our goals too, right, Colleen, was to help people sort of know what was out there.
Right, to navigate the different things that they have to, if they are dealing with diabetes.
Right, and not only just for the person that has diabetes or the family member, but even as healthcare professionals, we sometimes get so focused in our own specialty area that we really don't know the other healthcare professionals out in the community to refer patients to. So it's also an opportunity for physicians and other healthcare providers to look around the room and say, whoa, wait a minute. There are several resources that I can refer a patient to.
Right. And that was kind of a secondary goal of ours when we first established the symposium, was a way for medical practitioners and providers, exactly as Colleen stated, to recognize and know other specialties within the area that were as concerned about treating patients early, finding signs of disease early, and knowing where to send those people in kind of what we call the continuum.
Okay, would it normally start, do you think, at your primary care physician? But not only that, you should have a regular routine of having your eyes checked.
Yes.
When you have an eye examination, are they going to pick up, if you're just going in for a general, so they will pick that up and then refer you. So
I'm really glad you brought that up, because interestingly enough, I think the latest statistics were approximately 18% of individuals find out that they have diabetes during an eye exam.
Really?
So that is their first visualization. Yes. And during an eye exam, the doctors really can tell a lot about a person's medical history. We can establish if they have evidence of cardiac disease or hypertension. Really? We have found benign brain tumors during an eye exam. So it's critical to have your eye exam, even if, especially after age 40, and if you have a history of chronic disease, even if you're not having visual disturbance, you kind of want to make sure that you plan to have an annual eye exam.
And it's also important to have some family history as well, because diabetes can be...
It can run in the family, and it is considered a risk factor if diabetes runs in your family.
So not only is it important to see your primary care doctor, and whether you just have a regular checkup, and or the most important thing is to have your eyes regularly checked. Should you have your eyes checked once a year, once every 2 years, once a year?
The Academy of Ophthalmology recommends an annual exam for anyone over age 40. If you have symptoms, or if you're having any visual disturbance, you'd want to have it more frequently.
Okay, so the most important thing is to have your eyes checked, examined at least once a year.
At least once a year, or if not that frequently, let your doctor will guide you. Your ophthalmologist will guide you about how often they feel they need to see you.
Okay, because it can be caught, with an eye examination and then you can move on to find ways to help yourself live a very active lifestyle with diabetes. And we're going to talk more about that with Colleen Symanski, registered nurse and certified diabetic educator, and Cindi Green, registered nurse from Florida Eye Institute. Don't go away. We'll be right back. This is Cindi Bryant with Cindy's Health Beat on News Radio 105.7 FM and 1490 AM WTTB. Don't go away. We'll be right back.
There is more to hospice than you think. Hospice is about people who want to increase your daily quality of life with programs like music therapy, pet therapy, and veteran recognition. Caregivers have support with VNA nurses, counselors, chaplains, social workers, and volunteers. Far too often, families say they regret not electing hospice sooner for their loved ones. It's never too early to learn about the full benefits of VNA hospice care. There is more to hospice than you think. Learn more at vnatc.com/more to hospice.
Did you know Perkins Medical Supply has 4 locations in Sebastian, Vero, and Port St. Lucie and offers the most comprehensive medical supplies and services as well as rentals? Hi, this is Jeremy. Perkins provides a true 24-hour oxygen service, wheelchairs, walkers, hospital beds, and mobility scooters, along with diabetic, wound care, and ostomy supplies, and the latest selection of uniforms and accessories. We accept Medicare, Blue Cross Blue Shield, and more.
Perkins Medical Supply, for the care you deserve.
Neighbors caring for neighbors. Sebastian River Medical Center.
Sebastian River Medical Center specializes in exceptional and compassionate emergency room care with all board-certified physicians and a highly skilled and professional nursing staff. They are fully prepared to save a life or to take care of a less threatening emergency. Their fast-track system provides prompt care for all patients as well as a compassionate experience for your loved ones. Modern equipment and the latest technologies are just a few of the benefits of Sebastian River Medical Center's emergency team. There are 14 private treatment rooms, each equipped with a computer for easier access by the staff, which expedites the registration process. And then there's the staff, a caring and compassionate team offering prompt personal care and constantly updating you of your status and treatment options. Call 772-589-3186.
Setting the standard for hospital care. Sebastian River Medical Center.
After a surgery, injury, or hospital stay, your doctor may recommend home health care services to help you recover in the comfort and safety of your home. The Visiting Nurse Association's highly skilled nurses, therapists, and aides have been trusted to care for this community for over 40 years. The VNA is committed to providing patient-focused care so you can return to doing the things that are most important to you. When your doctor recommends home health care, you have a choice. Choose the VNA. Learn more at vnatc.com/choosevna.
Morning, and I'm back. Cindi Bryant with Cindy's Health Beat on News Radio 105.7 FM and 1490 AM WTTB. Thank you, Jesse, for the music. Gets us all in the spirit.
We love it.
Yes, we do. We have Cindi Green, registered nurse with Florida Eye Institute. She is the Marketing and Community Relations Director at the Florida Eye Institute. And Colleen Symanski, registered nurse and certified diabetic educator and owner of A Healthier Me. Now, we talked with Cindi Green in regards to the Florida Eye Institute and how important it is, we know, to have your eyes examined at least once a year, because a lot of factors can be found through your eyes, through vision.
Yes, correct.
So why don't you share with us a little bit about A Healthier Me, because once somebody is diagnosed, this is not your primary, you are a certified diabetic educator, but there are a lot of other items that come into play, health coaching,
yes,
and other things.
Yes,
and
okay. Let me just help you out. I was so intent listening on you that I failed to speak.
Well, no, that's not speak.
Oh my goodness, Colleen failed to speak.
I failed to speak.
That does not
unheard of.
That does not happen very often. I think she was waiting for me to finish my sentence, and I thought she was going to say something.
Right,
but anyway, let's talk a little bit about A Healthier Me.
A Healthier Me is really just as the name says, A Healthier Me. Our mission, and when I say our mission, my partner is Ken Symanski. He is my son, and he's just a fabulous personal trainer, athlete, and very calming and encouraging. And
he just did a mud rudder? What do they call it?
Tough mudder. And yes, he's crazy.
Mud rudder?
Yeah, tough mudders. That's when if you haven't done that, that's when you run through fires and over barbed wire and underwater cages and
through the mud.
Through mud, water. The more extreme they are. Yes. Yes.
So he is a real personalized trainer.
Yes, he is.
Okay, go ahead.
So he can. One part of what a healthier me does is we try to be there for anybody where they are in their health, wellness, and athletic journey and goals. But primarily, we really are a place where people can come, sit with us, and we listen to what they want to achieve with their health, what's important to them, what are their goals, and then we help them figure out alternatives to get there. That doesn't mean that you just come work out in the studio. We have a wonderful fitness studio and an office, but oftentimes we'll bring it to the road. We'll go grocery shopping. We'll go to produce markets. We'll hold culinary classes. We'll go run on the beach with people.
Or walk along walk along Ocean Drive.
Walk and shop.
Yes.
But, so whatever obstacle somebody's having, we try to make sure that we meet it where it fits their lifestyle, because it's very hard to change somebody else's lifestyle. So that's really our mission, is to just make healthier easier, one day at a time, little bit by little.
And one thing that you explained to me, because you know how I just love to train, it's very painstaking for me, and a lot of that has to do with the fact that some of us just don't pay enough attention to ourselves.
Right.
We're so busy trying to get everything on our to-do list done that sometimes we don't reserve an hour a day for ourselves. But it was interesting in the way that I've been able to do some training with Kenny, but also is the fact you don't have to spend 30 minutes in an hour in a gym. You have helped people break up 3 times a day, 10 minutes a day. I mean, that's not asking a lot, but a lot can be achieved with a simple 3 times a day, 10 minutes each, isn't it?
Absolutely. Especially people tend to sit more, drive more, so it will break up the routine of the day. So right after breakfast or before breakfast, you leave the house, go for a brisk 10-minute walk. You have lunch, get away from your desk and go walk before or after. And I've walked, I've had clients that come in and their blood sugars are elevated. And I'll say, come on, we're hitting the streets. And we go for a brisk 10-minute, and I limit it to 10 minutes. And we'll come back, and their blood glucose levels can have dropped 10 to 15 points.
Isn't that amazing?
Or to even 20 points.
Yeah. Right? Mm-hmm.
And you should see the look on people's faces when they didn't have to work real hard to see an improvement in something, because what we hear all the time is, oh, I'm going to go on a soapbox. Go on a diet. Don't eat carbs. Go exercise. Go run. And that doesn't work for everybody.
No.
And so we want to make it uncomplicated, easy, and we also want people to come in and experience functional movement. All of our bodies were meant to move. We need to learn functional movement, and that's not a gym. And that's the easiest place to start if you don't want an exercise program.
Well, that's what I like about what Kenny does, what you and Kenny do at A Healthier Me in the studio, in the fitness studio. That's what it is. It's a fitness studio. It's not a gym with machines and things like this. These are very, very creative training sessions, methods, yes, methodology that Kinney uses and breaks it up, that there's no monotony. I mean, I remember the old days going to a gym and you started here, then you moved to this, and then and the routine of okay, I know what I'm going to do next. It's sometimes it can be very boring.
And it's very repetitive.
It is very repetitive, whereas Kinney has got such a huge variety of things that he picks and chooses from that you don't get bored. Right. You know, all of a sudden it's like, oh, I get to do something different, and and before you know it, you're doing more challenging things.
Right.
So that's okay. So we know about A Healthier Me and what you do. We know what Florida Eye Institute is doing. Now we're combining the two for your 4th annual Diabetes Head to Toe Symposium and Health Expo.
And what a fabulous partnership it has been. Just I feel that we're so blessed. Not only am I blessed that Cindi and I have been supportive of each other, and that Florida Eye is equally supportive over the years and has a commitment, because it's been a commitment to bring this to the community and really a passion, because prevention and early detection is going to save people's lives, limbs, sights, and keep families healthier.
And we could share a lot of different statistics with the listening audience, but there's a huge demographic of people that not just live here in Indian River County, but across the country that is suffering with diabetes. And once they get to a certain point, it's like, oh, but what else do I do? And, you know, before you get to that point, that's what Florida Eye Institute and A Healthier Me is doing by bringing people into the symposium like this to learn from knowledgeable people, you know, how you can continue to lead a qualified lifestyle.
Right.
So share with us some of the speakers that you have coming.
We've got great speakers, and we have attempted to sort of have it make sense in the chronological way of if someone was first being diagnosed with diabetes, typically they're hearing about it from their primary care provider. And our primary care speaker is Dr. Brenda Field, and she is an internal medicine physician. And she is a great speaker because she breaks it down into kind of direct terms of what she is looking at in terms of numbers and lab tests, but explains it clearly on what you, the patient, can do to get control of those numbers. As we all know, Colleen has a great term for just the overwhelming knowledge of diabetes and trying to get a handle on it, and Dr. Brenda Field, too, breaks that down for people to understand in an easy way.
In our lingo, in our terminology.
And they all do, quite frankly. All of the doctors are dedicated to doing that. These are definitely not lectures or talks that are geared to the medical professional. It's for people to have good takeaway knowledge that's going to help make their life easier. Then following that, I'm sorry, Colleen, go ahead.
No, I was going to say Dr. Field and several of the other speakers, or most of the other physicians, this is their 3rd and 4th time. So they also love being able to spend time in talking to the community in terms,
because unfortunately in their appointment setting, in their practice setting, they're not able to spend 30 minutes with each patient, right?
No.
So to us, this is a gift from them to the community to offer their expertise and their insight for a full 30 minutes and then allow people to ask questions. I think that is truly a wonderful gift for people, because we're all kind of craving more knowledge, but we know that the internet and there's a lot of information out there, but that doesn't mean there's necessarily wisdom.
It's so confusing.
It's so hard to break it all down and get to the kernel of what's really true, and more importantly, what's going to work for me.
Right.
And that's what we're trying to do with this. After Dr. Field speaks, then we bring in Dr. Paul Graham, who's an endocrinologist, and he is the one that works with your medications to really help keep your blood sugars in a stable range.
Right.
Right.
Absolutely.
He's going to talk about some new medications that are on the market now and go over that very, very complex topic.
And he's going to talk about even the first line of defense, your first medications, and also get people to understand why you sometimes have to take 2 or 3 medications over the years, and why that doesn't mean that you have failed. It can be the progression of the disease and how you can slow that down.
And plus, there's just a lot of new developments with injectables and monitors and pumps and just
pens.
My goodness, just lots of stuff. So that will be a great talk. And then Tina Giambanco, who's a licensed mental health counselor. This is new this year that we are bringing in Tina to speak on the mental aspects and how to stay positive when you first hear that you are diagnosed with a chronic, lifelong disease pretty much. We all get a little shocked by that and can get depressed. And she is going to address that and how to, skills you can have to remain positive, to be able to make the changes that you need to make. Then Colleen is going to do a fabulous presentation.
Yes.
On and then Dr. Botto is going to speak on eye disease and diabetes, and Dr. Keith Kalish is a podiatrist who will talk about foot care, healthy foot care.
We're going to talk more about Dr. Botto and Colleen's presentation and Dr. Kalish when we come back from the break, because we're getting ready to, we've got great sponsors that allow us the opportunity to have guests in studio like Colleen and Cindi, informing the public about some wonderful opportunities that we have and the great health care that we have right here in Indian River County. So if everybody stay tuned, because we've got another segment, lots of information. Remember, November the 18th, mark it on your calendar, November the 18th, 10 to 2, First Presbyterian Church right here in Vero Beach. Free to the public. A light lunch is available if you choose for $5. You need to register. We'd like for you to register at 772-569-9500.
And doors open at 9 a.m.
And doors open at 9 a.m. And there's also a lot of other stuff going on with the expo. So don't go away. This is Cindi Bryant with Cindy's Health Beat on News Radio 105.7 FM and 1490 AM WTTB. Don't go away. We'll be right back.
Medical Center specializes in exceptional and compassionate emergency room care with all board-certified physicians and a highly skilled and professional nursing staff. They are fully prepared to save a life or to take care of a less threatening emergency. Their fast-track system provides prompt care for all patients as well as a compassionate experience for your loved ones. Modern equipment and the latest technologies are just a few of the benefits of Sebastian River Medical Center's emergency team. There are 14 private treatment rooms, each equipped with a computer for easier access by the staff, which expedites the registration process. And then there's the staff, a caring and compassionate team offering prompt personal care and constantly updating you of your status and treatment options. Call 772-589-3186.
Setting the standard for hospital care, Sebastian River Medical Center.
You can't always be there to help your loved one when they need it, but we can. The Visiting Nurse Association's trusted caregivers help with everyday tasks, like providing transportation, medication reminders, and assisting with around-the-house responsibilities. VNA caregivers are insured and undergo background screenings to preserve the safety of your loved one. With a VNA's private care services, your loved one will receive the help they need, giving you the peace of mind you deserve. Learn more at vnatc.com/private care.
Did you know Perkins Medical Supply has 4 locations in Sebastian, Vero, and Port St. Lucie, and offers the most comprehensive medical supplies and services, as well as rentals? Hi, this is Jeremy. Perkins provides a true 24-hour oxygen service, wheelchairs, walkers, hospital beds, and mobility scooters, along with diabetic, wound care, and ostomy supplies, and the latest selection of uniforms and accessories. We accept Medicare, Blue Cross Blue Shield, and more.
Perkins Medical Supply, for the care you deserve.
I tell you every week about East Coast Clinical Services. They're a wonderful full-service laboratory. So if you need any lab work done, blood work done, East Coast Clinical Services should be the place that you need to go. On Wednesdays, they offer everybody a cost-affordable lab fair. So all day, you could get the following tests done for just $10 each, and no doctor's script is required. So, for instance, if you're trying to monitor your diabetes, you'll need the Glyco A1C test. That's only $10. A CBC, a lipid panel, a comprehensive metabolic profile, a highly sensitive C-reactive protein test, PSA, a TSH, a ProTime, liver and UA, and a direct LDL cholesterol. Each of these tests are only $10 each with no doctor's script required. So remember, East Coast Clinical Services, 777 37th Street in Suite A107 in Vero Beach, in Fort Pierce, 2401 Frist Boulevard in Suite 8, East Coast Clinical Services. Welcome back to Cindy's Health Feed on News Radio 105.7 FM and 1490 AM WTTP. We are just having too much fun. Jesse, you found the perfect music.
Head to toe.
Head to toe.
Head to toe diabetes symposium.
Yes,
you threw us off.
To the rescue.
Yes,
That's fantastic.
We've just been breaking up during the break and dancing
breaking
to
up
this
and breaking
music.
down. Yep, head to toe. We love it.
I know it. That's
Thank
really
you.
going to perk everybody up.
You got it.
So, we're
Minor
back.
correction. We need to do a clarification. It's News Radio 105.7 FM and 1490 AM WTTP.
That's what
Where
it
the
is.
tropics begin.
Are you supposed to be the guest? You're not the co-host today, remember?
Oh,
That's
cut
okay,
that
but
later.
thank you. No. No, but we have Cindi Green, registered nurse, marketing and community relations director for the Florida Eye Institute.
Hello.
And Colleen Symanski, registered nurse, certified diabetic educator with A Healthier Me. She and her co-partner, her co-owner, Ken Symanski.
Yes.
Okay, so we're
Let's be
talking
careful
about.
we don't say co-partner, because I've had people come in and want to know if Kenny is my husband.
Oh.
Yes. Why, it is a compliment to me. You should see his little face on the look on his face.
Yeah.
No, that's my mom.
Yeah.
You want to say that again, Cindi?
What did I say? That's
cute. But we're just having so much fun because we are really excited about the music.
Yes.
See what music can do? I mean, that beat and that tone just really kicked us into gear for our last segment here.
It did. Yes, it did.
Talking about Diabetes Head to Toe Symposium and Health Expo coming up on November the 18th. 10 to 2. Perfect timing.
Yep.
First Presbyterian Church of Vero Beach. It's free. If you'd like to have a light lunch, it's $5. Call 772-569-9500. And there were a couple of other speakers. We talked about the internal medicine, endocrinologist, and behavioral counseling. Retinal specialist or ophthalmologist is Dr. Thomas Botto,
right?
And he's with the Florida Eye Institute.
Yep.
It's very important. Eyes checked. Sometimes if you haven't been diagnosed with diabetes, they will find that, or if you have it, or maybe something else. But you need to have your eyes
and it's
examined.
very important. If you do have diabetes and you know you have diabetes, you do need a retinal exam every year. There's no two ways about it. Most insurance companies right now are requiring the primary care physician to make sure that their patient is referred out for an eye exam annually. So we'd be delighted to help anyone with that, and that is one of the things that Dr. Botto will talk about is why is that important?
Yes.
People don't necessarily think those two things go together, but they do.
And Cindy, question, isn't that a dilated eye exam?
Correct.
Yes, it's
Correct.
not just any eye exam, not
Right.
just read that chart.
Right. No,
So-
this is a full dilated, what we call comprehensive
Yes.
eye exam for comprehensive eye health. And the reason that your eye is dilated is so that your pupil gets nice and big and the doctor can visualize the back of your eye, which is the retina.
Right.
And that's what they want to look at. And plus, there's some great newfangled tests that we do, too. We take great pictures with the digital technology that we have now, and so we can get a good photo of a place and time, of a time period with your vision, and compare that as time goes on, so we can see it, if anything is deteriorating, as well as visualize it. So it's good stuff.
Improving.
Good stuff. Yep.
Yes.
And Colleen, you are a presenter. You're going to have 30 minutes as a certified diabetic educator. What do we have in store?
She has a great presentation in store.
Well,
right, Colleen?
Yes, I do. I'm actually very excited. Cindy's been helping me with it, and it's going to be not so much a lecture, but it's a presentation, and
it's
our
fun.
audience will be able to meet Max and Maxwell. And kind of take
interactive
and take the journey of living with diabetes and living better with diabetes. And that's when we're going to also talk about, because diabetes is complicated. It's
Absolutely.
lifelong. And, diabetes mellitus, I thought, you know what? People are so overwhelmed, and their families so overwhelmed with diabetes. I know I get talking with my hands. So I'm using the term diabetes overwhelmness.
Oh, that's excellent.
We've got
Overwhelmness.
to address it. So the mission of my presentation, along with the help of Carol and Rosie, is to show people that it's a very personal path. There's not really a wrong path, but it's personal, it's individualized, and it's customized.
Right, exactly. That's what people have to realize.
Right.
It's customized. It's what works for you. It's not a cookie cutter. It's not somebody hands you a script and says this is what you have to do for the rest of your life. It's something that's I don't want to say easy, but you make it that way. Mm-hmm. People that come to you, you break it up for them and help them get to the level that the doctors want.
It has to be easy. Very few of us.
Now, physicians actually refer people to you.
Yes, they do, and they do. And one of my goals is to, since I have the opportunity this year, is to really explain what a CDE is, a Certified Diabetes Educator. There's 280 some odd thousand nurses in the United States, or is that Florida? That's Florida. Physicians,
Mm-hmm.
189,000. There's 82,000 registered dietitians. There's 15,000, only 15,000 CDEs practicing in the country.
Yeah.
And Colleen is one of them. She's right here.
Right here.
She's
in
one in
studio,
a million.
in
She's
Vero
actually
Beach.
1 in a million to us.
Yes,
so.
1 in 15,000.
Well, 1 in 15,000.
Well, translate.
But
it's the new math for
it's
me.
the new math. I
1 in a
like
million.
that, yes.
To you and I, it's 1 in a million, of course.
So there's a lot of people get me confused with what an RD is.
Right.
And it can be challenging for a healthcare professional to have really invested painstakingly a lot of time, a lot of studying to become board certified. And for the longest time, I couldn't understand why people didn't get what I did. We're a relatively new profession.
Yeah.
Right. And so she's going to show them. She's
great.
going to show them.
Yes,
right. That we put it all together.
It's going to be fun.
Right.
That makes
you
it
take
easier.
all these tools you got and you put them together.
Right. And then we also have Dr. Keith Kalish. He's a doctor of pediatric medicine.
Yes.
And that's another...
the feet.
Yeah, that is
your feet.
And that's another factor that diabetics really have to watch, are wounds.
Yes.
Or, watch...
Wearing the proper footwear. Taking care of the toenails of your feet, and because diabetics typically have they lose sensation in their feet, and so if they're trimming their own nails, they may not know that they've cut themselves or trimmed it too low, and they can get an infection, and once that happens, get a wound that's difficult to heal. There's just kind of this cascade effect that can happen with what we call neuropathy and its effect on your lower extremities, so on your ankle and feet.
Right.
And he will give some great hints about that.
Right, and the peripheral vascular disease that it causes. And even in this county, one of our outcomes that we're trying to reduce is amputations.
Mm-hmm. Really?
It's still a top indicator.
Yes. It's still a problem.
Yes, it is still a problem, even in Indian River County.
Yep.
Well,
we have way too many amputations.
And going through the speakers now, everybody can understand what you're talking about. Diabetes head to toe.
Correct.
Because we start
at the
mind
top
and work down to our feet. Because diabetes is complex.
Yes, absolutely.
It's not somebody to try to do it on their own. They really need guidance through their healthcare providers, through certified diabetic educators, through the Eye Institute, in wrapping up, and making sure that you have a good quality of life.
Right, and that's exactly it. We know that, like Colleen said, it can be overwhelming, and that is one of our goals to help break it down so it's not that way for people, so that they can understand how to manage and be healthier.
Okay,
That's
and in putting this together, you didn't just put this together in the last 2 weeks. You guys have been working on this
we have been working on it for a year.
Since
and actually because
year's.
we've done it. This is our 4th annual.
Yes,
we're delighted about that. And when we first started, this was kind of our ultimate vision, was to have a larger, complete symposium. I think you were the one that came up with that word. I was like, well, let's just do a lecture series. And Colleen said, no, we need a symposium.
Right.
And that word just sounded so fantastic. And so we worked towards that. And so we're very excited. And the resource information that we talked about, we have both local hospitals joining us, numerous other resource information from footwear to dentists.
Yes,
some people of the Health Expo portion of it. You're actually going to have resource material on site.
Yes,
for
free
people.
screenings and some free health screenings, blood pressure checks, blood sugar checks, vision screening.
There'll be tables. There'll be tables so that people can gather resource information, such as, and Cindi, thank you, such as the heartbeat, because there's always inspirational stories in there and stories of hope and resources. The medical services guide, that is a wealth of information in sections.
Oh, absolutely.
For diabetes, as well as the senior services guide. There'll be information on mindfulness, healthy eating, shoe wear, and we're also going to have people that you wouldn't expect to be there. So we don't want to give away all the little surprises.
You'll just have to come and see.
You'll just have to come and see. Perkins Medical Supply is going to be there, and they've been fabulous. They really have, and they've provided the props for me
your
to use.
Presentation.
And they do carry almost everything that you would really need if you have diabetes or the diabetes complications. But they have a lot of stuff to keep you active.
Yes.
They really do.
Yes.
Every time I go
socks,
in,
the new shoes.
Yes, the new shoes. I always have to say, no, you need to have a whole active wear section in here. This ain't medical. This is good health.
That's right.
I'm sorry.
Well, they're also, in Perkins Medical Supply is wonderful to many, many, many organizations, and I'm so thankful that they are a prime part of the expo with Diabetes Head to Toe Symposium and Health Expo. They're also sponsors of the radio show Cindy's Health Beat and Heartbeat, the guides and things like that. So they are a real participant here in the community. You've held this in Sebastian, and you've held this in Vero, and you were the recipient last year of the Public Relations Image Award.
Yes, we won submitted for an image award last year, and so it was very gratifying, wasn't it, Colleen?
Yes, it was. Much to my surprise. You did most of the work
to be recognized. So
it felt fabulous.
We were very happy about that, and I think that speaks to the uniqueness of the event and to Colleen's help and her contacts within the healthcare community and how we were able to bring it all together. And we want people to know that doors open at 9 o'clock, too, because there's some great information. We want them to have plenty of time to have a free screening if they choose, and to speak with the people at the resource tables and get all the information they need.
I'll be there
before our presentations start.
Yay.
And then We know it's a half day. It's a long time, but in the past it's been a 3-hour event, and it just goes by like that.
Just like this radio show. It goes just like
right,
that.
I know. I just got the cue. 2 minutes.
Okay, I have to say that Salties and Giuseppe's is actually providing customized lunches that are
diabetic appropriate.
That are just healthy appropriate.
Yes.
Yep. So
and tasty
for anybody, it's going to be fabulous. And so for $5, you are getting this custom lunch.
Yay!
Yay! Provided by local restaurants who are trying to make an impact to make dining choices easier.
And easier, tastier, and healthier.
Yeah.
So that's cool. Thank you, Cindi Green, registered nurse, Director of Marketing and Community Relations with Florida Eye Institute. Colleen Symanski, registered nurse, certified diabetic educator, co-owner of A Healthier Me here at Flamevine. Thank you, Jesse. I just want to shout out to Feed the Lambs. Colleen and I went to their gala last week. It was wonderful. John May and the whole board of directors are doing a fantastic job with Feed the Lambs. This is Cindi Bryant. I ask you do me a big favor. Reach out and help someone today. Make sure that today is the day that you make a difference in someone else's life. Cindi Bryant with Cindy's Health Beat on News Radio 105.7 FM and 1490 AM WTTB. We'll chat with you next week. November the 18th, Florida Eye and A Healthier Me, diabetes head to toe. Ciao.
First Presbyterian Church.
I tell you every week about East Coast Clinical Services. They're a wonderful full-service laboratory. So if you need any lab work done, blood work done, East Coast Clinical Services should be the place that you need to go. On Wednesdays, they offer everybody a cost-affordable lab fair. So all day, you could get the following tests done for just $10 each, and no doctor's script is required. So, for instance, if you're trying to monitor your diabetes, you'll need the Glyco A1C test. That's only $10. A CBC, a lipid panel, a comprehensive metabolic profile, a highly sensitive C-reactive protein test, PSA, a TSH, a ProTime, liver and UA, and a direct LDL cholesterol. Each of these tests are only $10 each with no doctor script required. So remember, East Coast Clinical Services, 777 37th Street in Suite A107 in Vero Beach, in Fort Pierce, 2401 Frist Boulevard in Suite 8, East Coast Clinical Services.
There is more to hospice than you think. Hospice is about people who want to increase your daily quality of life with programs like music therapy, pet therapy, and veteran recognition. Caregivers have support with VNA nurses, counselors, chaplains, social workers, and volunteers. Far too often, families say they regret not electing hospice sooner for their loved ones. It's never too early to learn about the full benefits of VNA hospice care. There is more to hospice than you think. Learn more at vnatc.com/more to hospice.
Neighbors caring for neighbors. Sebastian River Medical Center.
Sebastian River Medical Center specializes in exceptional and compassionate emergency room care with all board-certified physicians and a highly skilled and professional nursing staff. They are fully prepared to save a life or to take care of a less threatening emergency. Their fast-track system provides prompt care for all patients as well as a compassionate experience for your loved ones. Modern equipment and the latest technologies are just a few of the benefits of Sebastian River Medical Center's emergency team. There are 14 private treatment rooms, each equipped with a computer for easier access by the staff, which expedites the registration process. And then there's the staff, a caring and compassionate team offering prompt personal care and constantly updating you of your status and treatment options. Call 772-589-3186.
Setting the standard for hospital care. Sebastian River Medical Center.
When we get old, will you take care of me if I can't get around anymore?
Of course. We'll find a way. Are you going to take care of me if I can't see anymore?
I'll read to you every day.
And if one of us gets Alzheimer's disease, what then?
Call 1-800-437-2423 for a free booklet on caring for your loved ones from Alzheimer's Disease Research. 1-800-437-2423.
For money-saving tips that can help put your financial house in order and avoid future financial headaches, call the National Foundation for Credit Counseling today at 1-800-388-2227 or visit them at nfcc.org, a public service from the NFCC.